Hi, I'm Gina Salazar. Welcome back to the Better Arizona Show. Today we are taking you to the Fitzmaurice Hand Institute to learn more about thumb arthritis, the signs, the symptoms, and the solution. So, Dr. Fitzmaurice, welcome.
Hi, thanks.
So tell me a little bit about thumb arthritis and what that is exactly.
So it's just a wear and tear type of arthritis. There isn't any more joint space left. What we've noticed is some people have lots of pain, and you get an x-ray and the bones actually are okay. There's a space inside there. It's not really compacted in. That's early arthritis. What we found is that when you go in with the camera, you actually see that there is a defect. There's a particular area where maybe there isn't any more cartilage left. So it's starting, it's in its early phases, but it can still be quite painful. So what we can do for those patients is we still put in a camera and we clean up the joint with a shaver. We remove this inflamed tissue. Then we also inject this material into the joint, and that resurfaces, and it certainly brings down the inflammation in there. So this might be a way for a lot of patients to get this done early enough where they don't need this other reconstruction. So we like to be pretty aggressive with our treatment, because if we can prevent the need for a major joint reconstruction, it'd save them a lot of time.
And what are a lot of patients that have this experiencing?
So pain with thumb activities, and it could be, gripping anything heavy to even simple things like crocheting, you're going to have pain.
And who does this affect mostly?
We'll see it in women typically with 50s and 60s age group, but they don't necessarily have a history of beating their hands up with certain activities.
That's interesting, because that's what we assume, of course, is that often it's just, well, you've worn it down and it's wear and tear. Dr. Fitzmaurice, we had a chance to speak to one of your patients, Deb. Let's hear a little bit about what she has to say.
I was having a lot of pain every day. I would have to wear thumb braces at night to kind of relieve my pain because I just couldn't manage the pain very well. And I also dropped a lot of things. I couldn't open jars or open things. So that's the main thing that brought me to Dr. Fitzmaurice.
And then you've had a surgery like this done before, but it was substantially different. Tell me about the differences.
It's a huge difference. I had thumb surgery 9 years ago, and they opened my whole thumb area up and had to take out part of the bone, and they put my tendon in between to create a fake cartilage, so to speak. And in this one, the recovery was so much different. I was in cast for 6 weeks in this one and months of therapy. I was only in a cast for 1 week, and by 2 months I was done with physical therapy. I would highly recommend that they come and at least have a consult or do something to find out about this new procedure, because they'll be very thankful that they did. This other surgery that is the traditional surgery is really a long recovery, and it's painful, and it takes just a long time to recover from it.
Talking to Deb, we really heard about the differences that she's experienced, and she has just nothing but great things to say about how this has really changed her life.
Yeah, particularly if you've already had that procedure, then you have this one, then you really have something to compare it to. Our procedure, usually it's just a splint for 1 week, and then we're in a removable splint, and they're able to go back to some work activity fairly quick, even within a week or two, depending on what that work activity is.
What's your website again?
So it's fitzhand.com.
So, Dr. Fitzmaurice, thank you so much for having us here today and for all the wonderful information.
Great, thank you.
The Better Arizona Show will be right back.